Hi, my name is Dr. Dean Sorensen, and I've had cosmetic surgical practices in Boise, Idaho, as well as Maui, Hawaii. I'm here to have a conversation with you about Dermatique, one of my favorite subjects. I first became aware of Dermatique in 1989 at a major plastic surgical meeting in Toronto. I met Billy O'Malley, who was president of the company, and he had a display booth there. One of the things that impressed me was Dermatique's use with burn scars, and that's how I initially became interested in the product. In fact, Billy had the picture of a 6-year-old child who was severely burned, third-degree burns, over most of his body. He was 6 years out from his injury at a time when you wouldn't think there was any hope for improvement. Dermatique was applied and the results were dramatic. The post-op pictures were impressive. I went back to my practice and began to use Dermatique on facial trauma and scars. This included multiple teenagers that went through windshields with severe facial lacerations, and even a friend of mine who was in an airplane accident and I thought was going to be tremendously disfigured. He had probably the worst facial lacerations that I've ever seen in my practice. He was in the hospital for a month because of severe injuries, and during that time his wife dutifully put the Dermatique on 3 or 4 times a day. Today, my good friend has absolutely no visible scars from the use of Dermatique. I'd like to say it was my surgical technique, but I have to admit that this product was what really turned him around. In the 1990s, as many of you may remember, microdermabrasion, lasers, chemical peels became the rage for cosmetic improvement. I incorporated these procedures in my practice as well, and I began to remember about the healing aspects of Dermatique. So I started using Dermatique post-operatively on my patients. After all, these are thermal and abrasion injuries, and even though they improve your appearance, often there are healing problems. An interesting thing happened in my practice with the use of Dermatique. Although we carried many other skincare products, Dermatique began to fly off the shelves without any promotion. This happened because one patient told another about its use and its results. I've found through their unique formulation, which has hormones and other products, that the daily use of Dermatique significantly improved the quality of skin care in almost all of my patients that used it regularly. In fact, a number of the patients continued to use other products that they had for years but added the Dermatique. In some cases, the Dermatique was a standalone use that the patient had, and the reason is because they could see results. And so without any special promotion, we had a ton of patients on Dermatique. And I can't say enough about the good results that we had with the use of this product. In summary, if you're a cosmetic surgeon or a patient about to have a cosmetic procedure or somebody that's looking for a product to use on a day-to-day basis to enhance and preserve your skin, I think you'll love Dermatique. I recommend it highly.